friends. In today's session we are going to continue with our anatomy, and in the previous session we ended up discussing the introduction to anatomy, and we discussed about the concept of surface anatomy. So today we are going to continue, and we are starting with the anatomy of the upper limb. So this is the anatomical study, and we will study anatomy by regions. So we'll start with the upper limbs, then we'll go to thorax, then abdomen, and then other regions such as head and neck and lower limb. So we are starting with the upper limb, and we are starting with the osteology. So in this session we will study about the osteology, that means study bones. Also we study about the joints of the upper limb. So just stay tuned. Osteology and arthrology of the upper limb is discussed in this session. So first thing that you need to know, that the upper limb is divided into the three major divisions, about three major divisions. Here the head and neck. So here we'll have the joint, which is the shoulder joint, or sometimes it's called the glenohumeral joint. And from the glenohumeral joint, then we have the humerus. So here in the humerus, this part of the upper limb, which have the humerus, we call it as the arm. So here is the shoulder, and here is the arm. From there we have the elbow joint. From the elbow joint to the forearm, we have from the elbow joint to this wrist joint, we have the forearm. So from here to here we have the forearm. Forearm has two bones, which are radius and ulna. Radius and ulna. This is ulna and this is radius. So the forearm has two bones, which is ulna and radius. And then from there we have the hand, which has many small bones, and some of them they are irregular bones. So this is the upper limb, and it has the major divisions like that. So major division of the upper limb, we have the shoulder, and the shoulder, the junction of the trunk with the arm, or the shoulder joint, sometimes called the glenohumeral joint. We have the arm, the part of the upper limb between the shoulder and the elbow. Then we have the elbow, which is the junction of the arm with the forearm, or the elbow joint. And then we have the forearm, which is the part of the upper limb between the elbow and the wrist. So yeah, this is how. And then we have the wrist, which is the junction of the forearm with the hand, or it is sometimes called the wrist joint. And then the last we have the hand itself, which is the part of the upper limb from the wrist with everything distal. That means from the wrist to other thing until the end of the upper limb. So this is how we have different bones and joints of the upper limb. Here we have the region, here we have the bone, and here we have the joints. For example, in the shoulder girdle, we have the bones, which are clavicle and scapula, and the joints, we have the sternoclavicular joint and acromioclavicular joint. The sternoclavicular joint are the joint between the sternum and the clavicle, and the acromioclavicular joint is the joint between the acromion process of scapula and the clavicle. And then from there we have the region of arm. In the region of arm, the bone which you have is the humerus, and in the humerus bone we have the upper end, which is the glenohumeral joint, and then we have the lower end, which is the elbow joint. So this is how the arm has two joints, glenohumeral, or the shoulder joint, and then the elbow joint. In the region of forearm, we have two bones, which are radius and ulna, as I told you. And then here we have the humeroradial joint, that is the joint between the humerus and the radius. We have the humeroulnar joint, that is the joint between the ulna and the humerus. And these are two joints together, they are called as elbow joint. Then you have the proximal radioulnar joint and the distal radioulnar joint. Proximal radioulnar joint, that means it is near the elbow joint, and the distal radioulnar joint, it is near the wrist joint. Then another region of the forelimb, another region of the upper limb is the wrist and hand. And here we have the bones, which are 8 carpal bones, 5 metacarpal, and 14 phalanges. So we have the carpals, metacarpals, and the phalanges. Here we have the intercarpal joints, that the joint between the metacarpal bones. The joints between the carpal bones. Then you have carpal metacarpal. So carpal metacarpal, that means it is the joints between the carpal bones and the metacarpal bones. Then you have metacarpopharyngeal joint, that means between metacarpal and the phalanges. And then you have the interpharyngeal joints. So we'll not discuss in detail all of these joints, but we'll discuss the major ones which are present in the upper limb. So as you can see, the upper limb, here we have the clavicle, we have the scapula, we have the humerus, clavicle, scapula, humerus, then you have the ulnar radius, and then you have the carpal bones, we have the metacarpal, and then the last we have phalanges. So carpal bones, they're the one which are arranged here. Metacarpals are the one, but kutoka tu kwenye carpals easy, mifupa ya kwanza, the metacarpals, and the last the phalanges. So this is the X-ray of the arm, na hii hapa inaonyesha humerus. Kwa unaweza kuona jinsi gani tunavyokuwa tunajua the structure of humerus. It is because of different study mechanisms, kama tulivyosema kule mwanzoni kwenye introduction kwamba one among the technique used in the study of anatomy, it is through X-ray imaging. So we are doing the imaging of the bone like this, and we are seeing different structures such as the deltoid tuberosity. We are seeing the shaft of the humerus. Then we see the epicondyle, the trochanter, the trochlea. Then we see the ulna, we see the acromion process, the head of the. So we know the anatomy of the humerus because of different study modalities ambazo zimetumika. For example, kama unaenda cadaver, unapasua cadaver, you see the structure of the humerus, and then later unakuja kujua okay, now what I have studied it is true. Ndio maana tunasema kwamba in cadaver you are going to see what you have studied in the gross anatomy. Again, this is the X-ray of the forearm, but there is no need to discuss this because we discuss it later. This is the X-ray of the hand, showing the carpals and the metacarpals. So as you can see in the X-ray, the bones, they appear as white. The bones, they appear as white, and the air appears as black. You see, for example, all of this black background, this is air, and the bones, they appear as white. So because of the calcium which has been accumulated in the bones, it appears white. So let us study about the bones. And when we are studying about the bones of the upper limb, we have these important aspects to consider when we are studying about the bones of the upper limb. It is very important to understand that what is important for us to know when we are studying about the bones. So in the bones, we need to know first the name of the bone. We need to know the name of the bone. Then from there we need to know the exact location. Where is it located in the body? Then we need to know articulations. Articulations, that means joints. Articulate with what bone? Join na what bone? Then from there we need to know the main parts of the bone. We need to know the first surface markings and the clinical notes. So for all bones of the upper limb which we have mentioned above, we discuss them one after another. The name, exact location, articulation, main parts, surface markings, and clinical notes. So now let's start with scapula. A scapula is the flatty triangular bone that lies in the posterior chest wall between the second and the seventh rib. It has three borders which are superior, lateral, and medial border. It has three angles which are inferior, superior, and lateral angle. And the lateral angle bear the glenoid cavity. It has three processes, that means spine, acromion process, and coracoid process. So this is the simple anatomy of the scapula. It has three borders, three angle, three processes, three, triangular, three. So if we know the triangle has three angles, and the scapula also has three angles, inferior, superior, and lateral. Also it has three processes and three borders, and it is positioned in the chest wall is between the second and the seventh rib. All of these aspects you may be asked in the MCQ question, and it is very important for you to understand them. So now this is the anatomy of the scapula. and as how we said, it has 3 borders. So here is what we call the medial border, and here is the lateral border, and here is the superior border. From there it has 3 angles, which are inferior angle, then it has superior angle, and then it has the lateral angle, which bears the glenoid cavity. And then from there it has 3 processes. It has acromion processes, it has the coracoid process, and it has the spine process. The spine process, it appears on backward. Kwa mbele spine process hauwezi kuiona. So this is the anterior view, this is the lateral view, and this is the posterior view of scapula. Sasa it is very important for you to understand, is scapula unaweza kaulizwa, is this scapula of right hand side or of left hand side?